Here.
Hello.
Hi, Hilary. Right, so look, this is going to be an update piece. We're talking and something we want to be doing regularly. We're going to be regular updates on the situation in York and North Yorkshire. You guys have been doing an extraordinary work on it. For people who are just joining and learning, what is it they tried to do?
So I'll try and kind of round up the whole year in a bit of a nutshell, if I can.
Well, do you want to start with what they tried to do,
in the
and
first
then
place?
in the first place, so people
Yeah.
understand why this is so important, and then would be great. Yeah, talk about what you've then done, actually for people watching, if you've got any questions, just on whatever platform you're watching on, put your question in. We can see it here and we can answer it. So if you've got a question, put it in. Otherwise, hopefully we'll answer them all in an extraordinarily thorough.
I'll do my best.
Over to you, Hilary. So question one, what did they try and do?
Okay, so in March, we found out that the local Integrated Care Board, the ICB, had made a decision to bring in a pilot scheme for autism and ADHD assessments in York and North Yorkshire specifically. The pilot scheme was to reduce the access to autism and ADHD assessments because the influx was too high, and this was their way of trying to deal with that. On the 27th of March, they brought it in, and the criteria for assessment, so you had to meet these 3 criteria for assessment in order to access the waiting list. So those 3 criteria were: immediate self-harm or harm to others, a mental health assessment must have been undertaken and a crisis management plan in place. So that was the first criteria. The second criteria was risk of being unable to have planned life-saving hospital treatment, operations, or care placement. And the third was imminent risk of family court decisions determined on diagnosis, for example, family breakdown or custody hearing. So the very extreme kind of crisis criteria that they brought in, that was the bar of who got access to assessment. So that's what they were trying to change.
And the summary is you need to be suicidal, risk of self-harm or harm to others, family court, which essentially means most often means you're having your children taken away, or being taken away from your parents, and even with the crisis, like you still have to cross a bureaucratic hurdle of having a crisis team in place, which in itself is a difficult thing to has its own problems.
Yeah, it was enormous.
Yeah.
So they brought in this crisis criteria as an eligibility test for assessment. So if you met one of those 3 criteria, you were eligible for assessment. If you didn't, you were not. And
so that means most people who are struggling in life and having that realization that, gosh, I've got ADHD, like I would like assessment. You are not. That means that isn't. You're not an option for you.
No. So any problems with education, employment, your relationships, all the classic reasons why people tend to go for assessment, none of those were kind of noted or honoured in that criteria. It focused only on mental health.
And so that's cutting off the vast majority of people from being able to get support and help, and obviously very unfair, because under the NICE guidelines, an ADHD assessment should be granted to you. So, like, you and your organisation have just been incredible here. So, like, do you want to tell people what you've then been doing and what the results of that has been?
Yeah, so I'll just kind of clarify that the people who didn't meet the criteria did have access to an online tool called the Do It Profiler, which is basically an online survey that you fill in alone at home, and it gives you like a score and says that you're probably ADHD, you're probably autistic, and it actually says to you to seek a diagnosis, which you can't do, and it's part of the reason why you can't. So it's very frustrating for people. It gives people quite a lot of PDFs, files to read through in their own time, and the ICB consider that immediate support and guidance. So that's what we're up against. So I'm part of York Disability Rights Forum. We're disabled led. We have a neurodivergent subgroup. So all of us are neurodivergent, and we were part of a working group on neurodiversity and mental health, because we knew that there was an issue in the mental health system for neurodivergent people. And we were working with people within the NHS, within the local authority, the commissioners, for 2 years, trying to kind of figure out how to better serve our community. So through that, we found out on the 20th of March, so 7 days before it came in, that this pilot was happening. We raised loads of issues at the beginning, of course, as would be clear to anybody. That first criteria of risk of self-harm or harm to others kind of backwardsly encouraged self-harm. So we're really concerned about that. We were concerned about the impact on the community and on people who weren't eligible anymore for an assessment that would have been the day before. So we felt that was very unfair. It goes against, as you said, NICE guidelines. It goes against the NHS constitution. There were loads of other issues in terms of they didn't do any consultation for this. There was no community involvement. So we were very frustrated about that, because we were actually involved with the group. Like, we were there ready to talk about this kind of stuff. And so we know now that those decisions were made in October, November 2022. So we know that there was plenty of time. We met monthly, so it was, the community was there to be spoken to, but we were just left out of the loop entirely. So as a disability rights organisation, we kind of took up the mantle and said, well, we want to do something about this.
And the big issue is, like, obviously we've got the issue of people being deprived of the ability to get an assessment, and you've got the issue of this then other integrated health boards thinking, well, this is a good idea. And also some of the mechanisms that they used are things that are really nefarious. So they're not like, so one of the things they've defended, it said, like, well, it's not us, it's not like permanent, it's just a pilot.
Yeah.
And how many times has the pilot been extended now?
Twice. So initially it was brought in March as a 3-month pilot. So it was only 3 months. We said at the time, that's not long enough for a pilot. You'll never know anything after 3 months, which they already knew. I don't know why they came in with 3 months. I don't understand that process at all.
I think there's a very likely answer, which is that 3 months sounds like not a lot of time, and everyone will let this thing happen.
Yeah, and a lot of people did, a lot of people thought, well, it's only a pilot. People who were looking for assessment, they were thinking, well, I'll go to my GP after the pilot ends, after June, because it was supposed to end on the 27th of June, and it never did.
But it's a really nefarious tool to, like, try and get something past your population. And just to be quite clear, audience, it could also be a tool to work out good things and go, right, well, this is a pilot to test out, but it can also be used sneakily. Like many things have two sides of the coin.
Yeah, absolutely.
In this case, I think our position is that it was being used sneakily, and then the evidence from the continual extensions, and to be honest, that this isn't a good idea anyway. Like, it's not. Yeah, shouldn't
it's really
be considered.
not. It's not working either. Yeah. So
okay, go on.
Yeah, no, that's fine. So that working group that I mentioned, we had one other meeting of that on the 9th of May, where we had loads of feedback from the community about how horrified they were about this pilot. So we delivered that information and asked some really key questions about, how risk was being managed in this area, how they were keeping an eye on the people who weren't eligible for assessment anymore, all of those kind of impacts.
Yeah.
And we didn't get any satisfactory answers from that, but
something that I think is worth bringing up right now is that talk us quickly through, so that, because that risk management thing is a very, very big point. Like, and in particular, like, this entire argument is like, we're bringing the people most in need to the front, to the front to get to get seen quickly and efficiently, because we need to. How's that going?
Well, so obviously that crisis criteria suggests that they're prioritizing those most in need, most at risk. And it's a very risk-aware idea as far as they're concerned. But we know that up to today, not one of the people who have met that criteria has been seen for assessment. So in October, that was 501 people. 501 people.
And that's because they needed to go through. And that's because they need to go through their original list before they could move into this list. Is that correct?
Yeah.
And so people who are they have a list of people who are have a crisis team in place, who are at risk of suicide or self-harm or harm to others, who are family court, which will have been and gone at this point, I would expect, and they've seen none of them and helped none of them.
Yeah. And the other thing is that it was always part of the contract that they could extradite emergency cases or really crisis cases, like ones in court and things like that, anything life threatening. But
Yeah.
that was part of the contract already. That was already happening. So there was no need for this
Now
to
you're
happen
saying,
in that sense. Yeah.
now there's no, so some people won't know. So the Yorkshire was outsourced. The service was outsourced.
So yes, this isn't an NHS internal service. This is a company called The Retreat, who have been our autism and ADHD assessors in the area in York and North Yorkshire for quite a long time.
Yeah, and I'm mindful that I don't know much about the retreats. So I'm like mindful of talking directly about them. Whereas having a good hammer at the trust, or the Integrated Healthcare Board, game on for.
Yeah, and I suppose it's 6 of one and half a dozen of the other. Really, the provider.
Well, the Integrated Care Board is in charge of commissioning an adequate service that meets the NICE guidelines. And our big issue here is this other ICBs think this is a good idea elsewhere. And I think the big areas that you've targeted is saying to the Integrated Healthcare Board that you are not doing what's required of you. And that's the... and for people who are thinking, well, why not just use right to choose, Hilary?
Well, what they did was they changed the eligibility criteria for all assessment. So they still have right to choose as long as you meet the 3 criteria. So for the 501 people, if any of those people are here that you got through to that, through the criteria, you can now go through right to choose. And we had that confirmed last week. So that is still there. But for the vast majority, because they don't meet that eligibility criteria, because they've changed what it means to be eligible for an autism and ADHD assessment. That's what they've changed. They've changed the goalposts for who is eligible and who isn't. Whereas before it was a case of if you met, the diagnostic criteria, or if you, the screening criteria.
Well, it was a GP. It was your GP predominantly would review. It's an important thing. So one of the ways I like to try and describe the difference, what right to choose is that your doctor, your GP, makes the decision on whether or not to refer you. So they write the referral letter or sign it or whatever. You get to choose. You get to write the address on the envelope, and that's your right of where that letter then goes. What's happened here is, and this has already happened in other integrated care boards, so this is not exclusive here, is to say, right, the decision on doing an assessment is now moving from the GP and is going to be placed. We're going to put these hurdles in place, and you then don't have the right to choose. That's something that is being challenged. There's something that's being challenged, to be honest. But that's what they're doing. So they're saying, well, you can't use this right yet because you've not yet got a referral.
Yes, yeah. And that's the point, is that they've changed what it means to be eligible. And by doing that legally, they still have right to choose as an option. So in terms of the NHS constitution, things like that. So they've been quite clever, I would say, in terms of changing the eligibility criteria for all assessments. Changes the game entirely. And of course, that's attractive to other ICBs because right to choose costs a lot of money. And quite often you get into conversations about, well, if you took all of the money that you were spending on right to choose and put it back into the service, you'd actually have a much better service. But of course, they're not doing that. So it's an odd conversation to have. It's kind of circular. So right to choose was affected from the beginning of this. And actually what was horrible was a lot of GPs didn't know that. And so people went to their GPs thinking that they could go through right to choose. The GPs also thought they could go through right to choose and sent off the paperwork. And so there's some people in limbo at the minute waiting for this call from Psychiatry UK, ADHD 360, and they're waiting for this kind of call to assessment. And I don't think are aware that it's going to come back because it's not been funded. So there's a group of people we're quite worried about that probably don't know they're even involved in this. So it's a real worry for me, because I know like the numbers involved are mad. But I have some numbers for you if you'd like a few. So
let's do it.
Yeah. So anyone who's been following this will know that there's 3 waiting lists. And I know that that's quite alarming to a lot of people, and to kind of see it set out. But the waiting list 1 is when you're waiting for assessment. So your referral has been accepted and you are waiting for that first initial meeting, and they've sent you paperwork, like there's an email or a letter that says your referral has been accepted, you will be invited to an initial assessment. So that the group that are waiting for assessment in York and North Yorkshire, there's 1,700 people were on that on the 13th of June. These are when we had these numbers. So 1,700 people waiting for assessment. Then waiting list 2 is when you're waiting for your referral to be triaged. So the retreat will look at your referral when it comes in to see if it meets their criteria for assessment. And then if you meet the criteria for assessment according to them, you go on to waiting list 1 to wait for your actual assessment. So waiting list 2 is waiting for triage. And on the 13th of June, there were 2,396 people on that. And that includes, at the time, about 150 people from the pilot. So they were at the bottom of this list. So in terms of, the already existing waiting list, it was enormous, which is why they haven't gotten to anybody on that from the pilot yet. And then the 23rd of October, we have the final waiting list figure. So these are the people who haven't met the criteria. They have been involved in the pilot. They haven't met the criteria. So they've just had the Do It profiler and their little report. And there's 2,753 people waiting on that. And that waiting list at the minute is just waiting. There's nothing at the end of that. Now, there have been some changes, and I'll take you through them in terms of the timeline in a second. So yeah, if you're looking at the numbers, we're already over 5,000 people here. So that's an enormous amount for one service that isn't, overrun in psychologists and psychiatrists. So it's quite difficult to see how we're getting out of this easily. And one of the ways, so if we go back, it was a 3-month pilot when they introduced it. We had our kind of say on the 9th of May in this working group. That working group hasn't met since. So it's been basically taken away. It's been closed. And then regardless of all our emails and everything that we did in June to try and figure out what was happening at the end of the pilot, we found out on the 14th of July that it had been extended by 9 months to March 2024. So at that point, we felt that the community wasn't being heard. None of our concerns were being dealt with at all. We were really kind of pushed out of any kind of conversations around this. And so at that point, we sought legal support and legal representation, and opened a crowd justice fund in the kind of start of July. So that was amazing, and the community really stepped up. It was absolutely brilliant. We raised over £7,000 in the end, and we had to get over 5,000 or nothing was going to happen. So we got over 5, and we have lovely representation at Bindman's LLP, and they've been lovely the whole way through, and have been really clear and really honest, which is really helpful when you're doing this kind of work. And so the first thing that we did, we sent a legal letter that was about 20 pages long, of all of the ways in which the pilot was unlawful or against guidelines, all of those things that we've mentioned already. So that was quite a big piece of work, and we got a response at the kind of, we had to get a response after 2 weeks or something, and they gave us a response. But it didn't really address any of the issues, which was frustrating, but they did offer a meeting. And so we sent another legal letter saying, you haven't addressed any of our issues, but we're okay. Like, we're not going to stand in the way of meeting. So let's meet. And so, yeah, the most recent legal letter, all of these are on our website. So if you go to ydrf.org.uk, all of this is on there. So, if you get a bit baffled, don't worry. It's all on there. There's
and can people still donate to the legal crowdfunder?
Yeah, I haven't closed it, basically because we don't know what's going to happen next. We're in a bit of a limbo state, because at the moment the ICB are doing engagement work and saying that they're listening. So we have to give them the opportunity to do better before we then escalate, because at this point they have the opportunity to change what they're doing and to listen to the community. So one of the things, there's 2 changes that have happened.
Yeah, and it is wonderful, people donating and obviously go to ydrf.org.uk to do it. It is an important legal challenge, and you guys have done an incredible job of putting that together and making it happen. You really have.
Yeah, thank you. And I think I would like to be optimistic. I'd like to be hopeful. I'm very cynical as a human, but it's hard not to be, I suppose, when you do this kind of work and you keep not getting anywhere.
It's
But
just like,
there have been changes. So let me just cover the changes, because we want to be up to date, don't we? So one of the big changes that happened, this kind of all happened around September. The first criteria has been changed. So the reference to self-harm and crisis is removed, and they have changed it to, and I'll read it out because honestly, the way they've written it is awful, but I'll read it out and then I'll explain what it means.
okay.
So direct referrals from the community mental health team, people under the care of community mental health teams where it is identified that there are co-occurring neurodevelopmental conditions and or where the patient has support needs arising from undiagnosed neurodiverse conditions that overlap with symptoms of mental health problems, and where this creates barriers to making a diagnosis, and for the service to appropriately manage the patient's health. So we've got quite a different criteria one, but ultimately the change is you need now, if it's if the reason that you're seeking a diagnosis is because of your mental health and the impact on your mental health, you have to be on the caseload of the community mental health team. Now in York and North Yorkshire, that's actually quite tricky because our community mental health team is already overrun and it has its own waiting list. So that's a big issue. But then also the community mental health teams aren't well known for their understanding or acceptance of neurodivergent conditions. So there's lots of training that needs to happen to make them, to ensure that they're giving our community
and there's overall there's a massive issue, isn't there, of like people struggling for years, often sometimes decades, with anxiety, with depression, with other issues, and we hear time and time again where they discover and learn they've got ADHD, autism, and that unlocks for them the ability to change and forcing someone to also to get that unwell and forcing them to is fundamentally wrong. Like the whole idea is you want to get some before they're suffering from chronic anxiety, from depression, get them the help and support so they can thrive as early as possible. Don't put in barriers that says like, come back when you're depressed. Like, it's just like, come back when your life's ruined. Life's not ruined enough yet. Like, it's just like, it's outrageous.
It's really backwards. And like everything that you read, everything from any kind of mental health care point of view is early intervention is key. Early intervention is key. Early identification of autism and ADHD is key. And I do think there is some work going on in CAMS with children and young people. Hopefully that will develop over time, and we will get better at this. I am hopeful that in 10 years we will have some very different.
Well, look, we're fighting. Look, you're fighting the fight. We're fighting the fight. We're doing it together.
So I'm just going to tell you the other change.
Oh, okay, because I'm going to say you missed another one of your successes, which is I believe that there wasn't initially that list, the last list, which is obviously is a waiting for a bus that never arrives. But until your intervention, that those people weren't being collated; they were just being told no.
Yes, so that's the other change. So it's quite a significant change, this one, which came in September. No, it's fine, because they had started collating the information before that. You're right, in response to our kind of worrying about it. But now it's quite official. So I'll just have so basically people might be familiar with RAG rating within the NHS. So RAG stands for red, amber, green. So it's like a traffic light system. It's how A&E is managed. So crisis, you go red, you get seen quicker. Amber, you're a little bit more in the middle, and green, you're actually fine and you'll be waiting there for 12 hours. That kind of, way of looking at healthcare in general when you have very limited resources. So what they've said is that they're doing a RAG rating system, that if you meet the criteria now, you go through, which they've just renamed that as a red option. And then the waiting list of people that have not met the criteria are the amber green waiting list. So amber/green. Apparently it does actually score based on the Do It profiler, on the score that you get. So there is a scoring system. So there is some difference between amber and green, but ultimately it's the same waiting list. So that is still one thing.
Yeah.
And the only way off that waiting list at the moment is to deteriorate sufficiently that you meet the criteria.
It's
so
just appalling.
But the change is that the ICB are now holding that waiting list. So they are now responsible for it. So that's something that they changed in September. It's quite a big deal. So that's the third waiting list on our flowchart, but that is it does actually mean something. And I think it will take years. I would say if you're on that waiting list, it could take up to 5-6 years. But it looks like there might be hope for something to happen with that waiting list in the future, rather than nothing forever, which was the other option at the beginning of the year. So,
but is there throughput? Are they seeing more people than are coming onto the list? No, and so
not at all.
That list is going to get longer and longer. But you said it would take 5 years. So there's 5,000 people on the list right now. So you saying that they're processing they're assessing 1,000 people a year?
No, not at all. So as I say, the third waiting list of people who don't meet the criteria that's just a waiting list that's going to get much bigger over time, and it's going to be really incredibly difficult to manage.
Right.
But the waiting for assessment and waiting for triage, there's a couple of things that are changing. One is very interesting. Rapid assessment plans, so that they can do assessments quicker. And the ambition then is that they can do assessments quicker, and therefore they can get more done in a month. Their target is 80 a month, and if they meet that target this year, the first 2 waiting lists, as they stand right now, should get done over the next 4 years. So that's where if they manage the rapid assessment stuff, and if they can get to their target of 80 a month.
So the person last on that current list should be seen in about 2.5 years, which means also, am I right in thinking then roughly 2-year wait for the people who have been qualified as emergencies and crisis? And is that roughly when they start getting seen?
3.5. I really don't see them getting to the top for a long time.
Yeah, so it's and something that I had a journalist sort of talked to me about, which is, you talked about the RAG system, the red, amber, green, and talking about triage, and they said, well, the system's just being triaged. There's a very fundamental difference between triage and what's happening here. Triage sees people in order of need, and they all get seen.
Yeah.
That is not what's happening here. This is not triage. This is rationing. And it's curtailment of service in the spite of the fact that the service is supposed to be given, and that's a very, very, very different position. It's absolutely it's just so awful. Like, and what's your hope for next? Like, what?
Well, as I say, we're in a kind of limbo state at the moment. We met with the ICB last week, as we had agreed to do in our legal letters. It's a start, I would say. Some people were more open to conversation than others, but that's the nature of any kind of large organization. It's going to take time. And I think the good thing is that they're around the table. That's a really positive thing. That's not where we were in March, and that's not where we were in June. So I'm kind of grateful, I think, that we're at a point where we can sit around a table and have a discussion about what's going on. I think the practicalities are that there are an enormous amount of people who have just come into the realization of their neurodivergence, that they are autistic, that they have ADHD, that these things have been present for their entire lives. It's quite a shock to the system. And I think we're really lucky in the sense that we also have a group called Neurodiverse York, which covers North Yorkshire as well, because there aren't many things in North Yorkshire, but we're spreading out. But we have monthly meetups, and we have board game nights, and we have Dungeons and Dragons, and we have Ladies That Lunch, and it's an amazing kind of resource. So that because we get emails all the time that ask questions about, like, am I on this waiting list? Am I on that? When am I going to get seen? And generally, I'm giving them terrible, terrible news, right? Because none of this is good news. And so I'm also able to say, but you don't need a diagnosis to accept yourself. You don't need a diagnosis to come into the community. We welcome you. We don't care if you're formally diagnosed or not. If you recognize yourself here, you are welcome here. And I think that that's a really key, really important message to go alongside all of this horror, because otherwise, where's the hope? Where's the joy? It's really important to have both. It's a disability rights, right? So you're always fighting, but you have to keep space for what will help people get through this, and the community is the answer to that. It's people. And people have really
but it's absolutely wrong that people in absolute crisis aren't being seen, and it's wrong that people in need aren't being seen. You've got some fans who had lovely comment from Lauren saying thank you for advocating, and I just wanted to bring that up. And Russia has talked to that comment where we're talking about being neurodiverse on its own is enough, like, for life to be very, very challenging. And yes, we should intervene early. You shouldn't have to need to go to a place of having other mental health conditions. It's absolutely wrong. Thank you for that. She also put in a question, which I think probably it doesn't say if she's in your patch, but probably not, because she said, I've been waiting for right to choose for 8 months. They said they triaged me in April since inputting info in March. My GP told me the wait now is 18 months. What's happening in the meantime? That just does not sound like right to choose,
no.
Russia. Like it doesn't. That sounds like, because your GP, like, that sounds like you're on the wait list for your local service. For those that don't know, so right to choose is a right within NHS England to be seen anywhere in the country. Once you've got a referral, obviously that's what's happened here, is they've stopped you getting the referral from your GP, but thankfully at the moment most areas it is from your GP, and you then there are a number of subcontractors to the NHS for ADHD services, and they're colloquially known as the right to choose providers. If you go to the ADHD UK website, you'll see a complete guide on right to choose. It essentially is a guide to how to be seen by those should you want to. And what we do every single month is contact all the right to choose providers that we're aware of. I'm pretty sure we're aware of all of them, and find out their wait lists so you can make a choice. And right now, the shortest wait list, as I understand it, is 8 weeks. Okay, which is a pretty big difference from certainly the 18 months you've just been told about there. It's well worth considering. There's other aspects to think around that, but that is, it counts as an NHS assessment. You get an NHS prescription. You're not paying privately. It's something to seriously consider if you're in the NHS England area and you've got a long wait list in your local service. But go and have a look about it. But certainly, what you're talking about, Risha, does not sound like you're on a right to choose list. Like, I actually don't know any right to choose provider whose wait list is anywhere near that long.
No, but they do use that as ammunition. So one of the things that our local ICB said in their legal letter, more recent legal letter, was that they didn't want to do right to choose anymore because the waiting list had got up to 2 years. But they didn't mention a provider, and that's not what we're seeing. But also, just for Russia, that a common thing that seems to happen is that people go in saying that they want right to choose, but the GP actually doesn't particularly know what that is, so they just refer to their local organization or local pathway. So you kind of have to go in to educate, and it shouldn't be like that, but it is. So if you go in with your paperwork and with all of the stuff from ADHD UK or whatever provider, they usually have them online ready, so you can.
We are not a provider. Yeah,
I know, but you have.
We do science, but we get quite a few referrals from GPs saying, "Please, can I?" Like, we're like, "I'm sorry, that's not us." But it does happen, and I think people get us confused with ADHD 360 too. We get calls going, like, "I've not had any, like, I was supposed to have a follow up." We're like, "Okay, that's not us." But the challenge of everyone having a name ADHD something often. No, thank you. That was important. We tend to advise, by the way, people go to their GP, get have the ADHD discussion, and then go back the next day and talk about right to choose, you just give that to the reception or however, because you can get you don't want to conflate the two issues. Like it can be they're separate, and
I love that you think you can get a
appointments are
GP appointment in like 2 days. Where do you live?
Yeah, I do. That's why I clarified. You drop it off with reception. I was like, yeah, that's not how that works. You've been Rashir's asked a question. This one is to you. So, what's their rationale? So that's the ICB in regards to equitable provision for all, and not seeing those on a first come first served basis, please.
So in terms of, so they consider right to choose not equitable. So that's one of the things that is very interesting in their conversation.
I think this might be about the overall strategy.
Sure. So in their view, this is an equitable provision, the way that they have designed the pilot, because they are prioritizing those who are most at risk, and they are still giving a service to the rest of the people as far as the legal side of it goes. So the waiting list does mean something. They are keeping your your details on file, and they will get you at some point maybe in the future. So before March, it was a first come first serve. That was what it was. So they were seeing people chronologically. You got referred, you moved up. It took ages. You moved up the waiting list, and eventually you'd get an assessment. That was what happened before. Basically, the reason that they've changed it is because the provider, again, this is not the NHS. This is a group called the Retreat. The provider came to them in October, November last year and said the referrals have, they've gone up so much that if it continues the way it's going, we won't be able to meet the terms of our contract. And also the waiting list will be so long that the CQC will investigate us. So they were quite worried about a CQC problem. And that's why the amber green waiting list is under the ICB, because they didn't want to put it on the Retreat, because then they would have a CQC problem. I don't know why the RCB don't get a CQC problem, but CQC so far has been disinterested in this issue, as have NHS England, Health Watch England, any of the big people who should be doing this work.
Talking about NHS England, apparently there isn't a sort of part of, like we learned from HSJ, which is the journal for the managers of the NHS, that there isn't actually an individual group with strategic responsibility for ADHD. And so one of the reasons it's been just sort of hanging out is that there isn't anyone looking at it actively, and it's a huge issue. And I think just to answer Rashid's question a little bit, from my perspective, like it actually isn't equitable just to do something on first come first served, because if someone has really urgent need, you do want to see them more quickly. An A&E department is essentially that. Like it's the fact that you need to see some people very urgently, and that is true within the ADHD community, particularly where other things are going on. And like if there are huge risks, you want to get them. You don't want them. The damage is so substantial over that period, and could obviously be life threatening, that you want to get them care. The issue in York and North Yorkshire is that some people aren't getting seen at all. So this isn't triage. It's just it's some people being told doesn't know, even though they have clinical need, and that's the outrageous.
And the other thing, the kind of thing that's come up recently, which is very frustrating for me, because it's really difficult when you're kind of the face of it, I guess. People just assume that you're making stuff up. So, all of the ways and all of the emails that we get, all of those kind of things, when we communicate those, there's not necessarily an inherent belief in that these things are actually happening to people. It's very frustrating. But one of the things that keeps coming up is they keep saying that the Do It profiler is enough, that people are satisfied with the Do It profiler, and that the report that gives out, which isn't a particularly useful report,
there's a very, very big difference.
That it's not in it, like it. They say that's enough. People just want to know where their issues are. And I said to them, are you suggesting that, you know, people put themselves through this that don't want a diagnosis? And he said, I know people who don't want a diagnosis. They don't need a diagnosis. And I'm going, every single person I've spoken to wants a diagnosis. Every single one.
No, it's a completely different, like, we talk about it too, like the difference between thinking that you probably are ADHD or like is versus knowing.
Yeah.
Because some of the decisions you've got to make are quite difficult. They are hard to do, and you need to have that solidity of actually knowing, and it's a completely different thing.
But I think I sort of disagree. I think self-identification is perfectly valid and perfectly fine. I think the idea that
it's a fair correction. It can be. It can be.
But in terms of, you wouldn't put yourself through this if you didn't want a diagnosis. So there's nobody, as far as I'm concerned, who is comfortably self-identified who would now go through this process, because
you also
put yourself through it.
Like, it makes a big difference on workplace protections. Obviously, without diagnosis, you can't access medication if that's something you want to pursue. Like, and you know, people generally aren't coming forward for a diagnosis because they're worried. Well, they are usually struggling, and usually really struggling, and they're coming forward to their NHS and their local integrated care board, their health provider, and saying, I need help. And they're being declined it. And that is fundamentally wrong. We've had a couple of questions in. So Rusha has just clarified that she went to Psychiatry UK, was explicitly asking them, I'm very worried. I really think you should go and talk to Psychiatry UK. They will have, in my understanding of their process, is that you are acknowledged by them directly when you're on their list. And if you've not had that acknowledgement, then it sounds like you're not on their list. And I think you should contact them directly, because it doesn't add up right now.
No.
Something isn't right. Psychiatry UK did have some long lists. Like, the wait lists did get pretty long.
Yeah, and they did close it.
They've come down a lot now.
So
they did. They did. My understanding when I last spoke to them is they're now looking at around 12 weeks.
Yeah.
But I'm always terrified of saying numbers, one, just because I'm the one I recall is often not the one it's supposed to be.
Yeah.
And we should be just getting an update now anyway. But I would go and talk to them directly. You should. I'm pretty sure you should have had you should have had something from them. Apparently, she does get updates once a month. I don't understand why you're waiting 18 months. I would contact them. I was told 12 weeks. And if not, could you please contact us? Go to the contact us form on ADHD UK, click other and get in touch. Yeah. Oh, she's saying it's 11 months in total. That definitely could be right. It shouldn't be. I don't know. I'm lost. This is not we're going to have to stop it there. I'm very sorry about what's happening. Good luck. Right. Do you terrible question. Any final words? Anything you want to finish? Because you've spoken for a long time, and you're like, I probably said all you want. But
I just if anybody has a question, can you ask it? Because I think it's just kind of flowed through. I can't see. So if there are any particular questions that people want to ask, please let me know. But also you can contact us at nd@ydrf.org.uk. It's all over our website anyway. So if you look up the York Disability Rights Forum, you can find us. I don't know. I think, as I say, we feel like we've kind of settled into a bit of a long-term position. We've done some, I mean, I haven't even mentioned, we've done quite a bit with our local council. And I would say, if anybody's looking at doing this in their area, we've had real success with targeting our local councillors, our local government. There's been some movement in the City of York Council. I believe there will be some movement in North Yorkshire County Council as well. And I think, we had a motion passed that was to make York a neurodivergent friendly city, that kind of thing. Not in those words, but it was very much a commitment to working better with our community. And I think if you're facing similar things in your area, I think that's a really good place to target your local council.
Most areas are, right? Like most areas have substantial issues
Yeah.
around the waiting times, around putting hurdles in, around screening, around like the provision of non-medical support.
Yeah.
Because there's just none, right? It's just like, despite being part of NICE, that's literally laughable. So there's a lot, and actually, there'll be an announcement from us. We're reconfiguring our ambassador program to focus more locally, and actually, those points you've just talked about, the council is an area, particularly around NHS, that is not lobbied enough and has a lot of leverage. They are meeting with the CEO and the NHS leaders on a regular basis. There is an individual within the council, an elected official, who's responsible for adult services and who you can talk to and lobby, and they themselves are then talking. And those, getting those questions from elected officials to the NHS and the NHS leaders, that's a really powerful lever, and I think one that's underused. And I think you have done an exceptional job of working there and making a difference.
Yeah, and they all have a health and well-being board. They'll all have places where you can publicly participate. So go and have your voice heard at those spaces. It's very powerful when that happens, and when there's a few of you, it's even they don't expect you. That's the funny thing; they're not used to us being there. So kind of any interest at all is.
They do not get many people going to their meetings. They are public meetings, and like you turn up and they're like, "Oh, hello, who are you?"
And often they don't know anything.
It makes
about
a big
it as
difference.
Well. So don't expect that they know anything about this stuff. They don't. They really don't. So it is sort of down to us to do the educating again,
Yeah, it is, and one day, hopefully not. Look, brilliant. That's been a wonderful update. We've overrun as we'd knew we likely would, because God, ADHD, like the likelihood of us even running time, being in this context caring that we were going to run to time.
All I talk about anyway.
No, but it's I think it's been a wonderful update. I think the plan obviously is for us to do more of these. I think it's a great way to tell people. I think we like the long form of being able to sort of really describe what's happening. And if you want to get involved, get in touch. I think websites been mentioned a few times, ydrf.org.uk. Do. And if you're wanting to get in touch and start doing stuff outside, like in your area, if it's not in Yorkshire, then obviously get in touch with us. Like we want to, we're going to be lobbying locally and actively hard, and our ambassador program is getting reconfigured to become local lobbyists. That's happening at the moment, and will shortly be announced. So excited for that and the change will come. Coming into 2023, I thought this is going to be a substantially better year because it couldn't get much worse. And
oh well,
I think I'm hopeful it would be a good year, and it just has totally been just hard.
Yeah. It is.
Someone's mentioned Tom Watson, who's fantastic. He's obviously ADHD and a big advocate for ADHD, and obviously a great role model in being deputy leader of Labour, now being in the House of Lords, and just been quite the inspiration. I don't know why it was mentioned, but anyway. That's you and I out. That's been absolutely wonderful. Everyone, thank you so much for joining. Thank you for your questions. Hilary and everyone at Yorkshire Disability Rights Forum, you are amazing. I know that I know it's been tough, and you've achieved an enormous amount. And you've not allowed something that would have just been allowed to happen. You're not, and no doubt that victory will be got, and it's your efforts that will have got it. So Thank you.
Thank you. And thanks for having me. You know, it's important that we get this out. Again, as you said at the beginning, we're worried about it spreading. So the more people that know about it, the more alert people can be.
And some aspects of it already are like, so that's happening. So in terms of like making it harder to get the referral, taking it away from GP, putting in this step, that's happening across. And so some of these aspects are, and it's obviously a very bad thing. Okay, we're going to end the stream now. Thank you, everyone. Obviously, look, we're both organisations that want your money, so I think we'll both do our. So look, go and donate to York Disability Forum, Rights Forum, YDRF.org.uk. You can donate to their general fund. You can donate to their legal fund, which is supporting the legal challenge against this, which is a wonderful thing. And I would say do that. Obviously, if you like what ADHD UK are doing, we get no government funds, entirely reliant on private donations. Please donate. We can do nothing without you. Like, genuinely, not. No. And I can tell you, like, raising money, like, we can both attest to this. Raising money for mental health is tough. Like, people aren't so happy to shake a tin or run a race with a badge on, do sponsorship. Like, most people are still wanting to be quiet about it, which is understandable, but like, it makes it so tough. It makes raising money so tough, and can't do anything without it. So do donate to both of us. Right, thank you everyone for joining. Thank you, Hilary. You're all wonderful. Thank you.